tooth extractions under any kind of sedation or general anesthesia. Hi, I'm Dr. Shreya Krishna, your trusted oral and maxillofacial surgeon from New Delhi. पेशेंट्स की जो एंजाइटी होती है उस वजह से डेंटल एक्सट्रैक्शन या टूथ एक्सट्रैक्शन एक बहुत ही फियर्ड प्रोसीजर होता है. उस वजह से बहुत पेशेंट्स ईयर्स एंड ईयर्स अवॉइड करते हैं अपना बहुत ही खराब दांत निकालना, या अटेम्प्ट करा के मिड ऑफ द प्रोसीजर दे हैव टू अबैंडन द प्रोसीजर. जनरल एनेस्थीसिया एंड सेडेशन में टूथ एक्सट्रैक्शन कराने की डिमांड इंक्रीज हो रही है. I want to enumerate कि हम किन केसेस में टूथ एक्सट्रैक्शन अंडर सेडेशन या जनरल एनेस्थीसिया कर सकते हैं, यूजुअली करते हैं, एंड अगर आप कराना चाहते हैं तो व्हाट आर द इम्प्लीकेशंस ऑफ द सेम. सो सबसे पहले लेट मी टेल व्हाट इज द डिफरेंस बिटवीन सेडेशन एंड जनरल एनेस्थीसिया. इन सेडेशन you are in a relatively deepened state of consciousness, subconsciousness. However, your reflexes of the body like circulation and breathing are still totally under your control. In general anesthesia, जो आपकी breathing circulation is still intact, but जो आपकी breathing control होती है और आपका जो state of consciousness होता है, it is very deep. It's in a very deep plane, and the breathing is no longer in the control of the body. In fact, the breathing is taken care by machines. So sedation is a lesser level of subconsciousness, and general anesthesia is a very deep level of subconsciousness. Now, when do we choose either, and do we take extractions under any of these kind of anesthesias in routine procedure? So routinely अगर हमें extraction करनी है under sedation या anesthesia, वो किन situations में की जाती है? First, patients जिनका intellect level or their intelligence is slightly compromised due to certain medical conditions, like patients with cerebral palsy, patients with any kind of mental disturbances like mental retardation, Down syndrome. These are commonly the kind of patients जिनको हमें sedation में या general anesthesia में ही हम कर पाते हैं procedure, because their mental capacities do not allow them to cooperate on the dental chair. The second very common subset of patients जिनको हम extraction करते हैं under sedation or anesthesia is pediatric group of patients. Very small children who require extraction due to whatever reason, maybe a cavity formation, maybe tooth erupting in a very abnormal location. वो अगर बच्चा है less than 5 years of age में cooperation by a child to remove the tooth can be very, very tough. In this case, we do consider sedation or general anesthesia depending on so many other factors, and it is undertaken routinely for children under the age of 5 years. And the third subgroup of patients is patients with certain medical conditions जिसमें the risk factor of doing the extraction while the patient is awake is much higher than taking the patient under sedation or anesthesia. So what are the nuances and what are the factors of taking a patient of extraction under general anesthesia or sedation if you want to get it done? सबसे पहले under sedation or under anesthesia requires you to be medically fit. The fitter you are inherently, the safer the anesthesia or sedation procedure is for you. If you are somebody who's already suffering from certain other kind of procedure, medical comorbidities, like if you have any kind of respiratory problems or if you have any kind of heart problems, then the risk of that general anesthesia or that sedation itself is higher than doing the same thing when you are awake. For example, अगर आपको किसी भी type का lung condition है, like you have obstructive pulmonary disease COPD, which is very common in the Indian population, then if we have an option that we can do the same thing under local anesthesia or general anesthesia, we usually prefer local anesthesia, because general anesthesia में जो आपको हम ventilator पे डालते हैं for that short period of time, that exacerbates your COPD. Again, if you are having any kind of cardiac risk factors, then again general anesthesia increases the risk of cardiac events to an extent. So sometimes it sounds like extraction is easier under general anesthesia or sedation. However, there are many factors to be kept in mind before we decide whether we can do a procedure under sedation or general anesthesia. The last segment I want to tell you that if you are a fit and healthy person, in what case, and you're not in the previous two categories, which is pediatric patient, patient with any reduced mental capacity, or patient with medical conditions requiring sedation, what are the other conditions in which the doctor itself prefers sedation or anesthesia for an extraction? First, if it is a long and lengthy anticipated procedural time, if any extraction is expected to take 45 minutes or longer, it is better to be done under sedation or general anesthesia. Second, if the location of the tooth is very close to a very important blood vessel or nerve, it is better to be done under general anesthesia or sedation, so that those factors can be better controlled of bleeding rather than what can be done on the dental chair. If you are somebody looking for an extraction under local anesthesia or general anesthesia, please drop in a comment, like, subscribe to our channel. Thank you.